Hey, what's up? I'm Riley. I'm a nurse. I thought I would take a look on Reddit and read some medicine horror stories, hospital horror stories, kinds of things, and give my 2 cents because why the hell not give people what they didn't ask for? Also, I kind of like Reddit stories. Alright, so the first one comes from someone named Structured_Anarchist, and this was posted a couple of years ago. I was in the hospital for an infection in the bones of my foot. I take medication for a heart condition and diabetes. Nurse came in one evening to give me my medication. She brings me strange-looking pills, and I ask her what they are. Awesome thing to do if you're not sure what you're being given, please always ask, what are you giving me, if you have not explicitly been told. A big part of nursing is the 5 rights, and I've also been told that they've been changed to 7 now. Right patient, right medication, right route, right dose, right time. She tells me 2 medications I've never heard of. I tell her she might have mixed my medications up with somebody else's. She says no, she's sure, take the pills. I refuse. I ask for the head nurse for the floor or a doctor. The head nurse comes in. I ask her what medication I'm supposed to be receiving. She checks my chart, confirms what I'm supposed to be taking. I ask her to ask the original nurse what medication she had in her hands. The nurse leaves the room, and a third nurse comes back in with the right pills. Head nurse comes back in and tells me that the original nurse will no longer be responsible for my care. Probably shouldn't be responsible for anyone's care at that point. The next day, the nurse coordinator comes in with a digital audio recorder and a notepad to go over all the details of what happened the night before. From what I learned later, this isn't the first incident with this nurse giving out the wrong medication. And look, we all make mistakes. It does happen. The important thing is that you acknowledge that it's a mistake, report it as soon as you're aware that it's a mistake, and make it right. She had done it to a couple of other patients, and I heard she had been suspended pending an investigation. Don't know what happened because nobody ever contacted me after that. Yeah, it's not really surprising that nobody contacted you after that unless you were starting to pursue a lawsuit. There's not really a reason for them to contact you because they had the nurse taken off of the floor, probably terminated if I had to guess, if this wasn't the first time that this happened. Good job standing up for yourself. I think I might do a little series on this, and it depends on if you guys like it or not. So drop a like or a comment and let me know what you think. If you want me to read a story of yours, feel free to send me a request in a DM and I will do what I can to get to it. Bye.